The prostate massage has been used since 19th century as one of the form of treatments for prostatitis, or also called inflamed prostate. Now, some people have started using this method to treat erectile dysfunction, but can it really help? For which causes of erectile dysfunctions this method can potentially be beneficial, and for which is not? How to use the prostate massage safely? Well, let's figure this whole thing out. Prostate massage is a medical or therapeutic practice that involves stimulation of the prostate gland, a small gland located just below the bladder in every man. Prostate massage can be done externally by pressing in the area between the anus and the scrotum, called perineum, or internally through the rectum. For internal massage, a glove and lubricated finger, or there's also some special devices in the market, are used to gently massage the prostate gland. People use prostate massage for several reasons. Regular prostate massage is believed to be very helpful with the flow of the prostate fluid, which can reduce the risk of prostatitis or inflammation of the prostate gland, as well as some other prostate issues. For example, men who have problems with ejaculation, such as painful ejaculation, often find relief through the prostate massage as well. For men with chronic prostatitis or chronic pelvic pain syndrome, prostate massage can help to reduce the symptoms by reducing the inflammation and improving the circulation in the prostate gland and the area around the prostate. Now let's dwell on the last point that I just made in more details. It is a well-known fact that the erectile dysfunction, sometimes caused by pelvic pain syndrome, also called chronic pain syndrome or CPPS. Now, CPPS often causes tension in the pelvic floor area, which negatively, of course, affects the blood flow and nerve function necessary for the erection to occur. Also, chronic inflammation of the pelvic nerve can directly impact the nerve responsible for erectile function. Prostate massage can help to improve the blood flow to the prostate and nearby area, of course. And better circulation, of course, can help to reduce the inflammation and help to heal the irritated tissue, enhancing the erectile function. It can also help to relax the pelvic floor muscles, reducing the pain and improving pelvic function. Relaxed muscles can improve the blood flow and the nerve function that needed for the erection to occur. So in this case, you can try the prostate massage to treat erectile dysfunction caused by this particular problem. Also, with the condition like the benign prostatic hyperplasia, also abbreviated BPH, this massage can help to reduce ED symptoms. For example, one study of 150 men looked at prostate massage therapy for those with enlarged prostates. It showed that the prostate massage could potentially help and relieve symptoms, but it did not focus just on ED. However, many of the studies are very small and limited. This is why there's not much evidence to support the prostate massage as a treatment for erectile dysfunctions. But there's also no studies that shows any harm at all. As a matter of fact, as a part of our erectile dysfunction treatment in our center, we utilize sound wave therapy, which I speak quite a bit on, also called low-intensity shockwave therapy. And as a part of this treatment, the particular focused shockwave is performed at the area of the perineum, external, of course. This is done not only to repair the deep blood vessels of the perineum and pelvis, but also to break down the scarring within the prostate gland and to improve the blood flow to and within the prostate, as well as to relax and repair deep muscles of the pelvis. This method can also significantly improve the function of your prostate along with the erectile function. If you don't know what causes your erectile dysfunction, and there can be many causes, I recommend you to come for free consultation to our Center for Men's Health in New York. We will determine the cause and will choose the best treatment based on your individual situation. The link to book an appointment is always in the video description. If you still want to try the prostate massage as a method for erectile dysfunction, first, of course, consult your doctor and follow this safe protocol. Number 1, it's important to be relaxed and to empty your bladder and bowel before the massage. Number 2, use the water-based lubricant to avoid discomfort. Number 3, use a position such as laying down on your back with the knee bent or laying on your side. And last but not least, the gloved lubricated finger is gently inserted into the rectum and the prostate is massaged in a circular motion or with gentle pressure. As you can see, the prostate massage can be very helpful for some cases. But for many men with mild or even moderate erectile dysfunctions, there's often no need for medication, surgeries, or even massages. All they really need is to make some lifestyle changes. So watch this video where I talk about the recent studies that looked at how lifestyle changes, the very simple lifestyle changes, can significantly affect the quality of your erection and, of course, change the quality of your life. Best of luck.